Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today our topic of discussion is oxygenation. We will discuss this topic in different parts. Let's start the first part of oxygenation. Today we will start this topic with the review of respiratory system. Then we will discuss the factors affecting respiratory functioning and the self-care behaviors for promoting oxygenation. The primary purpose of the respiratory system is gas exchange. This involves the transfer of oxygen and carbon dioxide between the atmosphere and blood. The respiratory system is divided into two parts, the upper respiratory tract and lower respiratory tract. The upper respiratory tract includes the nose, mouth, pharynx, epiglottis, larynx and trachea. And the lower respiratory tracts includes the bronchi, bronchioles, alveolar ducts and alveoli. The lungs are a collection of 300 million alveoli. Each are 0.3 millimeter in diameter. Because alveoli are unstable, they have a natural tendency to collapse. Alveolar cells secrete surfactant. Surfactant is a lipoprotein that lowers the surface tension in the alveoli and it reduces the amount of pressure needed to inflate the alveoli and makes them less likely to collapse. Then the blood supply, the lungs have two different types of circulation. One is pulmonary circulation and bronchial circulation. Next is the control of respiration. The respiratory center in the medulla is located in the brainstem, respond to chemical and mechanical signals. Impulses are sent from the medulla to the respiratory muscles through the spinal cord and the phrenic nerves. The chemical and mechanical signals include the chemoreceptors. First is the chemical signal, that is chemoreceptors. It is a receptor that responds to a change in the chemical composition of the fluid around it. The central chemoreceptors are located in the medulla and responds to change in the hydrogen ion concentration. And the mechanical receptors are located in the lungs, upper airway, chest wall and diaphragm, and they are stimulated by a variety of physiologic factors such as irritants, muscle stretching and alveolar wall distortion. And the respiratory muscles include the diaphragm and intercostal muscles. The process of oxygenation is performed through ventilation, diffusion, transportation and perfusion. Next, coming to the factors affecting respiratory functioning. First is levels of health. Acute and chronic illness can affect person's respiratory function. For example, people with renal or cardiac disorder often have compromised respiratory functioning because of fluid overload and impaired perfusion. People with chronic illness often have muscle wasting and poor muscle tone. These problems affect all the muscles including respiratory muscles. Alteration in muscle function contribute to inadequate pulmonary ventilation and respiration. Next is developmental consideration. In case of neonates and infants, but necessitates many adaptation by newborn. The most obvious change occur in the lungs, which are transformed from fluid-filled structure to air-filled organs. The respiratory rate is more rapid in infants than at any other age. Surfactants is formed in utero around 34 to 36 weeks. An infant born prior to 34 weeks may not have sufficient surfactant produced, leading to collapse of the alveoli and poor alveolar exchange. In case of toddler, preschooler, school-aged and adolescents, the preschooler child's eustachian tube, bronchi and bronchioles are elongated and less angular. Thus, the average number of routine colds and infections decreases until the child enters school and is exposed more frequently to pathogen. By the end of late childhood and during adulthood, the immune system is prepared to protect the person from most infections. Next is in older adults, specific physical changes occur in older adults that are unrelated to any pathology. The tissues and airways of the respiratory tract become less elastic. The power of respiratory and abdominal muscles is reduced, and therefore the diaphragm moves less efficiently. The chest is unable to stretch as much, resulting in decline in maximum inspiration and expiration. Airways collapse more easily. These alterations increase the risk of pneumonia and other chest infections. Next, coming to the medications. Patient receiving drugs that affect central nervous system need to be monitored carefully for respiratory complications. For example, opioids are chemical agents that depress the medullary respiratory center. As a result, the rate and depth of respiration decreases. There is a possibility of respiratory depression or arrest when administering any narcotic and sedative. Next is lifestyle. Activity levels and habits can dramatically affect a person's respiratory status. People who exercise 3 or 6 times per week can better respond to stressors to respiratory health. Cigarette smoking is a major contributor to lung disease and respiratory distress. This cigarette smoking may be active or passive. Next is environment. There is a correlation between air pollution and cancer and lung disease. A person with adequate respiratory functioning who is exposed to air pollution may experience uh, coughing, choking, headache, dizziness, like these things. Occupational exposure of asbestos, silica, coal dust, as well as environmental pollution can lead to chronic pulmonary disease. Additionally, people who have experienced an alteration in respiratory functioning in the past often have difficulty continuing to perform self-care activities in a polluted environment. Next, coming to the psychological health. Many psychological factors and conditions can affect respiratory system. Individual responding to stress may exhibit hyperventilation. Generalized anxiety has been shown to cause enough bronchospasm to produce an episode of bronchial asthma. In addition, patients with respiratory problems often develop some anxiety as a result of the hypoxia caused by respiratory problem. Next is the self-care behaviors for promoting oxygenation. How we can promote our oxygenation. Follow a regular exercise. It may be in the form of walking, jogging, swimming, whatever it is, with 30 to 45 minutes of moderate activity. Maintain normal body weight. Obtain medical evaluation for chest pain, problems with breathing, chronic cough with sputum or blood. Incorporate a plan to reduce smoking and then stop smoking on a specific target date. Avoid exposure to secondhand smoke or a passive smoke when possible. Receive influenza immunization as per schedule. Maintain a pollution-free environment as much as possible. Support the community efforts to keep the air free of pollution. Next part of this topic will coming soon. If this video is useful for you, then it is requested to put a like and share it with others. And for getting more videos like this, You can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.